Deep neck lift or deep neck contouring versus deep plane, it's not really a versus. As a matter of fact, they're more often than not, they're combined. So what is a deep neck contouring procedure? In a nutshell, a deep neck contouring is basically the removal of some of the bulk that people carry in this part of their neck, you know? And the majority of the time is fat. Occasionally can be a salivary gland that has come down, you know, and this creates this fullness here. So as part of the deep plane facelift, oftentimes we do a deep neck contouring. So before we lift, we empty the space, we suture the muscles here, and then we lift, and that's how we can really get the neckline to really come up, you know? So as a matter of fact, when I do facelift surgery or rejuvenation surgery, there are 4 things to me that go hand in hand, all of those 4 things. Deep neck contouring, deep plane facelift, temporal lift, and fat transfer. And what that means is this. You know, you see a patient, they have sagging, they have fullness on their neck. So what do? We remove the fullness, we address that, and then by removing the fullness, we're creating laxity. So now we have excess of muscle lax, you know, and then we'll do, so a deep neck contour, deep plane facelift. So we empty the neck and now we lift. When we lift the neck, especially in the deep plane facelift, you know, we are bringing the face kind of like in a more vertical direction. And this brings some fullness in the temple, and which is why oftentimes we have to combine with a temporal lift. You know, a rule of thumb for this is when patients, if they do this and they have a bunch of bunching over here, they will benefit from a temporal lift to, again, to continue to distribute that laxity. And the 4th piece of the puzzle is, again, the fat transfer, primarily around the eyes, you know, under eyes, temples, under the brow, you know, because this is an area that we tend to deflate as we age.